Yeah, there is conflicts in some of the diagnostic tests. And of course, the antigen test detects the adult female worm. Microfilaria tests, on the other hand, detect circulating immature worms. And sometimes dogs will have a negative antigen test. You would presume that they don't have adult worms, but you pick up the circulating microfilaria. And so you ask yourself, how could this be? Well, there are lots of reasons for it. Without getting too complicated, there could be adult worms there, but our antigen test is not sensitive enough to pick them up. It could be that the adult worms were at one time there and had died and were past the point where you can detect them. It could be that some prior veterinarian had eliminated the adult worms but had failed to eliminate microfilaria. Microfilaria can persist in the dog's circulation for 2 months or more. So you understand that there are complications. And what I tell my students is there are 4 factors that you have to understand. You have to understand heartworm biology. And what that means is, where is the heartworm in the dog and when is it where it's at? Number 2, you have to understand the preventives. What do they eliminate and what they don't? Because they are different. Number 3, you have to understand the adulticide, and that's the medicine we use to kill the adult worm. What it kills, what it doesn't kill, when it works better than it might work at other times. And the last is diagnostic tests. What are their limitations? And that's 4 factors that can interact with one another in very complicated ways. And that's why in one of my favorite lectures, I say heartworms will find a way to fool you. And that's because of all of the variables that are involved.